Yes, I remember in 2004 when I first came here to see Dr. Tong, I was absolutely desperate. I was in so much pain and misery and had been admitted to the hospital after going to ER. I think they admitted me 2 times and couldn't find out what was wrong with me other than diabetes. But why did I have such serious chest pain where I couldn't even breathe? I couldn't take a deep breath, and the pain was so bad and it kept getting worse and the attacks more frequent, where one night I couldn't even sleep, I couldn't get up, I couldn't walk down the stairs. I had to sit and go down the stairs so I wouldn't wake anybody up, and I went downstairs and I cried. And at 5:30 in the morning, my husband came down and said, "What's the matter?" And I said, "I want to die. I don't want to live like this. I can't take it anymore." And out of desperation, I found Dr. Tong, and I came, and he didn't have to take more than one look at me, and he knew all the symptoms. He verified what was going on with me and did the treatment. The first treatment, I got up off the table and I felt much stronger, and the pain subsided greatly, where I could take a breath and I wasn't in so much pain. And then the second treatment, I felt fantastic. And Dr. Tong predicted maybe 4 treatments would do it, but I wanted to take more because I was worried. It was so much that I had gone through, so many tests, tests about my heart. My heart was okay. And a test in the hospital that they gave me on the treadmill and things, blood tests all over the place. Dr. Tong never had to do any of that. And within 3-4 treatments, I was better than new. And even my diabetes had subsided. And I feel fantastic. And I'm 62 years old now, and I haven't had a pain since the 4th time I was here for treatment. I have no breathing problems. I exercise every day, walk my dogs, and life is great. I haven't had a treatment since 2006, and this is 2008, and I still feel absolutely fantastic. I was so impressed of the treatment, and how I felt, what it did for me. I had this 91-year-old aunt that was in terrible shape. She had emphysema, asthma, frequent bouts of pneumonia, intestinal problems. She was an absolute wreck, and all the doctors ever did was throw prednisone at her, and her bones just crumbled after years of prednisone treatments. And she still wasn't well. And I brought her here, and we started giving her the treatment, and after all the doctors said she should have been dead a long time ago, she lived 3 more years without a lot of pain, and I eliminated a lot of the drugs that they gave her, including terrible drugs that were psychotic drugs. She didn't need them anymore. She wasn't sleeping at night. I brought her here. She started sleeping through the whole night without some of the drugs that they prescribed for dementia. And her appetite improved, and one time I brought her in and she was on the verge of pneumonia, and with the treatment, it was gone. She came in on oxygen, and I checked her oxygen levels with the blood oxygen, the pulse oximeter, and after the treatment, the blood oxygen levels were way up. She walked out of here without the oxygen tank. Well, now here I am again, and I'm bringing another aunt, a different one. She's 91, and she's suffering greatly from thyroid problems and epileptic seizures and venous insufficiency and dementia. And she was an RN all her life and didn't know anything else except medications and drugs. And when she had the serious seizure, I went to help her. And by helping her, I felt bringing her here to Dr. Tong was the best thing to do for her. And she's undergoing treatment now. And I've seen an improvement in her. I brought her in and her legs were so swollen that the edema was terrible. Now, I've been a registered nurse all my life. I'm a USC graduate, same as Dr. Tong. He and I went to school about the same time, same place. And I was at County Hospital for a long time. I saw a lot of things, but this is so much better than drugs, and it's working. And now my 91-year-old aunt's swelling in the legs, the edema has gone down dramatically. And I even find that her dementia is better. And here we're taking a treatment today, so I want to see more improvement in her. Well, we're talking about Aunt Margaret, 91 years old, and she's only had 3 treatments and 1 acupuncture treatment, or 2 acupuncture treatments, and she's improved greatly. When I brought her in, of course, we had the venous insufficiency and the edema, swelling of the legs. They were huge, and now, just after these few treatments, they're practically down to normal. There's very little edema left. Also, she had quite a bit of dementia and couldn't even put 2 and 2 together and talk. Now her conversation is better. She's improved greatly in every respect, and even with the kidney and liver function. And we should be getting her back on track in a couple more treatments, and at her age, she's responding beautifully to these treatments. And wave at the camera with your hand, the other hand.
Hi, Margaret. This is Margaret. How old are you, Margaret? Do you remember?
How old am I?
Mm-hmm.
97.
She 97?
No.
91.
91.
Margaret was brought in May of 2008. What happened? Karen, you want to tell a little bit about her history?
Margaret had a seizure, and she was living alone up until then, and not being well cared for, failing a little bit, having some problems with thyroid, and she fell, which I believe is what started the seizures, hit her head, and had head trauma. So that started some very serious seizures, and she was put on all kinds of drugs and in the hospital, and I saw her deteriorating with all these drugs. So I said as soon as I could get her out of the doctor's care when they released her from the hospital, I brought her here to see Dr. Tong and Dr. Elaine, and she's made a tremendous improvement. She had venous insufficiency, high blood pressure, many other things, and we've gotten her off all of these drugs and onto natural, holistic products that are supplements, and the shots and the acupuncture have just made her life so different, and she's doing beautifully now.
How are her legs compared to before?
Well, with the venous insufficiency, there was not much that they could do except take tests, and her legs were so swollen, they were like balloons, and now, I mean, they wanted to put the compression hose on her. We had 2 pairs of compression hosiery, and it made her so miserable. The first time she took a scissors, cut them off. Second time she threw them away and nobody could find them. I don't blame her. I wouldn't want that on me either.
Her legs
and
don't
her
look
legs
too
are
bad.
her legs are great. They're perfect. Yesterday I got shoes on her, which we couldn't do for months. And her legs are down to normal just about.
Yeah.
No swelling at all. So
and then she fell also a couple weeks ago and broke her wrist?
On the 20th of last month, and had a compound fracture where the bone came right through the skin.
Oh, no.
Oh, yeah. But it's doing much better now, and Dr. Elaine is giving the injections in the hand. And
swelling has gone down.
Swelling's gone down greatly.
Document that.
And
Still a little swollen.
It's still a little swollen because she still has the venous insufficiency, but with what we're doing, it's really progressing nicely. And I expect by next week and next treatment it should be pretty normal again. And not only that, she's healing faster because the orthopedic surgeon said, "Oh, you're healing nicely."
Good.
So I think it's giving her the strength to heal too.
Say hi to us, Margaret.
Hi. Is it all right with this hand?
That's fine.
How about the other hand? Can you move that too? Wave at the camera. There you. Oh, very good.
She's moving her hands now. Good.
Yeah.
And how is she cognitively?
Much better cognitively. Yeah.
I heard that she's repeating herself less.
A lot less. Hardly at all.
Good.
Car rides are much easier for me now. Right?
Okay.
Yeah.
Yeah.
Good. Smile for us, Margaret.
And Margaret makes more sense now like she always used to, where for a while, with all the drugs in her, she wasn't making any sense at all. Now she can remember what she ate and pretty much a lot more things than what she did before. And we're making more sense, and we're all happier to see that.
Good. Okay, we're going to follow up very soon. Thank you
Life
so
is
much.
good.
Good.